Welcome back. Today we're going to be diving into one of the most common and often the most challenging symptom of menopause, vasomotor symptoms, or VMS. These include both hot flashes as well as night sweats and can be incredibly disruptive for women during menopause and beyond. So let's break down what vasomotor symptoms are, who's at risk, and most importantly, how we can treat them. Vasomotor symptoms are a collection of symptoms, the most notable being hot flashes. They are usually characterized by a sudden feeling of heat that may or may not include sweating and is often followed by a chill. These can occur at any time during the menopause transition and even will persist for some women beyond menopause. Who experiences vasomotor symptoms? Well, virtually all women in their menopause transition will experience some vasomotor symptoms. There are some factors that can make it more likely. For example, women who smoke, have an increase in adiposity, or have more stress or anxiety are likely to experience more hot flashes. In fact, 1 in 4 women will experience severe, long-lasting vasomotor symptoms that can last into their 60s. The root cause of vasomotor symptoms occurs in the brain, in our thermal regulatory center, which is located in our hypothalamus. When estradiol drops during the menopause transition, it triggers an overactivity of certain neurons in our brain called candy neurons. Vasomotor symptoms aren't just about discomfort. They can have far-reaching effects. Studies show that women with vasomotor symptoms are more likely to experience depression, anxiety, cardiovascular disease, and even bone loss. Vasomotor symptoms are even associated with decreased work productivity as well as lost wages, so they really can have a far-reaching effect on women and their families. There are many types of treatment available for your vasomotor symptoms. For many, systemic hormone therapy can be highly effective, but it's not for everyone. But there are other options, including paroxetine salts and a new drug which targets vasomotor symptoms at the root cause. We also use many medications off-label to treat hot flashes. These might include venlafaxine, gabapentin, or oxybutynin. And let's not forget cognitive behavioral therapy and clinical hypnosis directed specifically at hot flashes, which have been shown to improve vasomotor symptoms when compared to placebo or sham therapy. Sometimes we combine treatments for the best results. For instance, we may use paroxetine or venlafaxine for women who have both vasomotor symptoms as well as mood dysregulation. The key is finding the treatment that works best for you. It's important to note that women who have experienced trauma in the past are at an increased risk for vasomotor symptoms, even if they've dealt with the trauma before. For those women, addressing those experiences is often crucial to managing their menopausal symptoms. Managing vasomotor symptoms is all about taking a patient-centered, tailor-made approach. If you or someone you know is experiencing vasomotor symptoms, know that you're not alone, and there is help. Whether through hormonal treatment, non-hormonal treatment, therapy, or other lifestyle modifications, relief is possible. Stay tuned for more information on this topic, and thanks for watching.